Hello, good morning. Welcome, welcome, welcome. My name is Allison, and I'm really happy to be here with you this morning. We're going to be working on some glute strength today. So let's start with a little bit of breathing. Have a seat on a block or a pillow. Get comfortable. Tune into our bodies. So with your head, bring your head back, stack your head right over your hips. Keep your chest nice and lifted. Close your eyes and take a few deep breaths in and out. One more breath, big breath in, and a big breath out. And we're going to do 3 rounds of alternate nostril breathing. Cha-Cha will be here to help us. You can stay here. No? Okay. I'm just going to observe from the gallery. And so here we go. We're going to take the first 2 fingers of your right hand and place them right between your eyebrows. Take your thumb to your right nostril. Exhale before you do that. And then inhale through your left nostril. Inhale to about 80% and then hold the breath at 80 and switch. Take your ring finger to your left nostril. Exhale through the right. Keep your chest lifted, keep your elbows slightly lifted and your chin slightly pulled in. Inhale through your right nostril. Hold the breath. Switch and exhale through your left. That's 1 round. We've got 2 more to go. Inhale left. Hold your breath. Switch and exhale through your right. Inhale through your right. Keep your head over your hips. Switch and exhale through your left. Inhale through the left. Switch and exhale through the right. Inhale through the right. Gentle hold. And switch, exhaling through your left. And we'll complete our 3 rounds this morning. So just take a regular inhale and exhale through the nose. And we're going to begin with some glute activation this morning. And in particular, we're going to turn on this little area we call the underbutt. So to find that and to isolate that, we're going to lie down on our backs for a moment. And when you're kind of thinking about and talking about glute strength, you usually have a lot of glute muscles that take over. We're going to keep them from doing that. We're going to make all of them work equally and do their job. So if your arms are along by your sides, just kind of cup the bottom of your bottom. And then what you have in your hand, that fleshy little piece that you have in your hand, we're going to call that the underbutt. It's like the part of your gluteus maximus that is. It's the very bottom tip right above your hamstrings. So I want you to think about that part. And I want you to contract it. So I'm going to do my left side first. You'll probably barely be able to see anything happen. Because if I squeeze it, it's likely that my whole glute maximus wants to do that work. So I'm going to back off on how much effort I'm using. I'm going to do a little squeeze. And then I notice, like if I put my hand right here in the inguinal crease, that my hip flexors might want to turn on. But I don't want my hip flexors to do the work for this piece. So I'm going to, again, lower the amount of effort that I'm using until I can feel that my hip flexors don't activate here. The other thing that sometimes activates for people is the hamstrings. So if your hamstrings also try to do the work for this little piece, we're going to make sure that they don't and inch your foot out in front of you just a teeny bit until you don't feel your hamstrings doing that work anymore. And you can just squeeze and squeeze without any help from any of its other friends. Right? Squeeze, squeeze, and squeeze. All right, now we're turning that on. We're going to use it here in a minute. But first, we're going to go to the other side and activate that underbutt piece. So right here, we're going to squeeze, squeeze. Notice the main part of your glute max. And if it's trying to do that work, again, you're going to back down on your effort. This isn't how hard can you squeeze, it's can you isolate, which is a whole skill on its own. And check for your hamstrings. You don't want these to do that work. So again, that's the foot reaching out just a little bit and then also going down in effort. And then check for your hip flexors over here too. And sometimes it's on one side and not the other, right? And squeeze, and squeeze, and squeeze. So you might only be using like 10, 15% effort. And that is going to give you more effectiveness than a big squeeze. 2 more. Last one. And relax. Okay. Now roll to your side and gently push up to seated. So that part is super useful if you do hiking, walking, running. We all do those things, right? Not all of them maybe, but at least one of those. I know you walk around. Because we're going to stand up here for a minute. I'll give you a moment to stand up with me. And we're going to be working in a crescent lunge this morning. Crescent lunge is a high lunge. So if I come here on my mat, what I'm going to do is I'm going to take my feet about hip distance apart, and I'm going to take my left leg straight back, and I'm going to come into this position without a lot of momentum, just nice, gentle ease and softness. So if you look down at your right knee, you want your right knee over your little toes, the little 30 toes. So you might need to push your knee out if you're a knee in person. And we want to kind of activate this outside line. So the ankle, the knee, the hip. Imagine that you have 3 dots connected here, and there's this line between. And you're going to push, just energetically push. And it's not a big push, so if your knee goes way out here, that's too much. Just want you to energetically push. You see how little I went right there? Yep. Now from here, pull your upper thigh bone into the hip socket. And it's just, again, it's this tiny little piece. And now you can connect your heel to your bottom tip of glute maximus, right? Your underbutt. Right, why don't you just feel that for a moment. And then when we step forward, I want you to keep your knees bent. So it's going to be like a chair pose. I'm going to do that without momentum. And then we'll step this other leg straight back. And we're going to connect the heel to the underbutt. 3 dots. Energetically push up. Pull the upper thigh bone into the hip socket. And notice that your heel and your underbutt connect to each other. Lift your chest and breathe. That thigh pulling in kind of makes a little bit of a difference. For, I don't know, maybe like 2 to 5% people who have done this with me in the past have a little bit of pain because of a joint condition. So if that's you, you're not going to pull in so much. You're going to pull in just enough to activate, but not to activate the pain. All right, that's just like in some severe arthritis cases and things like that. All right, now we're going to bring this leg forward, and we're going to switch. Coming back into that right leg. That outside line is activated. We pull the thigh bone in, and we're going to take the chest, and we're going to start to keep your hips exactly in where they're at. And bring your chest forward, connect your heel to your underbutt, and then lift up. And then come forward again, keeping everything from the belly button down connected, and lift up. Pulling that upper thigh bone in a little bit, lean forward, and come up. And you can really, really feel that muscle. And forward one more time, hold. and then lift up and step slowly, gently, without a lot of momentum in your joints. All right, because momentum you're just kind of moving your muscles with your joints when you feel that momentum moving you. All right, pull your thigh in toward the hip socket. Connect your heel to your underbutt and lean forward. And lift up. And forward. Now, this is a very specific type of glute strength, isn't it? Again, this is that little piece that, man, if it's strong, running time improves, your cycling time improves. For all my athletes, this is a nice little piece. We really maximize on this. All right, and then come forward into your chair pose. Let's step back with that left side one more time. Now we're going to do this thing I call the hobby horse. So if you see a hobby horse, it's on a brass pole, and it doesn't go forward or back or side to side. It goes up and down. So that's exactly what we're going to do. We're going to pull this thigh bone in a little bit. Feel that activation. Connect your heel to the underbutt. And we're going to slowly go up and down, up and slowly down. And unless you're doing this, like if you're just here and you're not doing this with me, but you're watching, I want you to do this with me because it's not something that you can watch and get. You got to do it to get it. One more breath. And then as you switch, stay in a chair pose. Come forward without momentum and step back without momentum. Hold that upper thigh bone in just a little. It's subtle, but the subtle work actually is, I feel like, a little more advanced than the bigger moves. It cultivates a whole lot more strength in the long run. So here we go, lifting up and down. And connecting heel to underbutt, your underbutt's lifting you up and down, straight up, straight down. Two more. Sink in, come forward with both feet, forward fold. Make sure your ribs rest on your thighs, bend your knees as much as you need to do that. And then rock your weight back into your heels. Take a nice deep breath. Press your heels gently apart. One more breath. And then drop your heels into the floor and connect your feet to your spine here. See how they're connected. When they drop in, your spine lengthens. When they drop in, it lifts you up with a straight spine. We don't want to roll through the spine. We just want to lift straight up. Right. Okay. So let's go into some more glute exercises today. We're going to keep kind of using that underbutt. But before we move on, I want you to walk around a little bit. And then just get kind of connected to how the glutes are, quote unquote, performing. How it feels. How it feels. That's right. And we're going to add a little glute minimus to the picture. The glute minimus, you might have heard about that muscle. It's a small muscle. It does a heck of a lot for your hip health. But it doesn't burn a lot of calories because it's small. So most people don't talk about it, but it's super important for keeping you injury-free and for keeping your body mechanics in check, your SI joints feeling good, your overall hip health, so you don't have any hip pain. So here's the deal. It's up here. It's kind of right below the top of your pelvis, if you know where your sacrum is. And you take your hand about a couple of inches out to the side and an inch down That's the part we want to be working. So lift your leg up to a 90-degree angle. Fold your knee is at a 90-degree angle, and your thigh parallel with the floor. Flex your foot. Now it's likely that you're in a little bit of external rotation. So I want you to pull it in and internally rotate. All right, and that is going to turn some muscles on, first of all. And then when you lift, so you might think heel up, but I want you to think not heel up. I want you to go so slow and think thigh bone up. Thigh bone up. So that really turns on your glute minimus. Thigh bone up. Internally rotate. Thigh bone up. And you know, I'm only lifting a few inches because if I'm lifting a lot, I'm completely not using that muscle. In fact, I'm not using many muscles at all. So do that for a second, just pump and notice like I'm not using much muscle to do that. But if I slow down and go in this small increment, man, whew, all right, put your knee down, come back into a little child's pose. Nice deep breath. And then come up onto your hands and knees. Put your elbows down. Take your knee to a 90-degree angle. All right, to check this, check over your shoulder and then check underneath. Internally rotate your thigh and thigh bone up. Thigh bone up. Thigh bone up. Thigh bone up. Feel all the muscles. The slower you go, the better this works. This muscle prevents a heck of a lot of injury. Thigh bone up. Let's do 3 more. 3, 2, and 1. Look at how much strength you built in that exercise. Maybe you didn't even do quite as many reps as what I did because it takes a minute to get that built up. All right, let's stand up now and take a little walk around. So I want you to notice how your walk begins to change. How your muscles are moving your skeleton forward rather than having your skeleton pushing your muscles, right? This is going to be so much better in the long run for your joint health. And at the rate that they're doing these joint replacements these days, I really want for you guys to have healthy joints. That's what I think is so important. But also, if you're a runner, think about your running and how much this underbutt and glute minimus make a difference to pushing off. Or if you're a hiker, how much will they make a difference to your ability to not use your hip joint to pull you up the hill? You get your muscles involved, and it'll be a different experience. Okay, so let's do just a little bit of stretching just to kind of get those muscles to relax, to release, so that we turn them off. So we're going to lie on our backs. Just want to face this other way because I think you'll get a better view this way. So lying on your back, I'm going to take this leg up and I'm going to take it and externally rotate it. I want to take this knee in front of the left shoulder. I'm going to grab the outside of my right heel and bring it towards me. I'm not going to pull, I'm just going to assist with this hand. So if you don't have as much external rotation ability, not a problem. Just be where you are today. Nice deep breath. Relax. Second side, we're going to take this knee in front of the right shoulder now and grab the outside of the heel and breathe. How lovely is this. Let go. And then either extend your legs out long and close your eyes for a short rest, or put your legs up the wall. And then, even better than that, go out and have fun and use those glutes. Go for a hike, go for a walk, or dance around your kitchen. I don't know. But now you have access to these muscles. So, anyway, there we are. That's our Sunday glute practice. Stay tuned for more. And if you're curious about more hip health, reach out. Leave us a comment. Or you can reach out on our website, MoveWellWithUs.com, and reach out and let us know what questions you have. Until I see you next time, take really good care. I'll be back tomorrow. See you then.